My name is Michelle Awino. I am in 7S. I am in Muthaiga Primary School. I come from the family of 4 children. I was so happy when I was writing it. I was writing about how COVID ruined our health, how many people died because of COVID, and how many people are still affected with COVID, and how COVID made our school to be closed, churches, and some children not seeing their parents. I wasn't happy when I heard that schools are going to be closing and even churches. Many pupils have not studied well because of closures of school, and many children are still affected with COVID-19. When I had my friends or my relatives are affected with COVID-19, and there are some teachers who are even affected with COVID-19. So it didn't make me happy when I heard some of our people are infected with COVID-19. Yeah. When I was reading it has encouraged me to be going on with my studies, so that when I grow up, I will be a good doctor, but not only a doctor, but a neurosurgeon. I want to treat my patients well, and I want to do everything that I can do to make my patients feel better. My message to Kenyans is that let us join hands to beat Corona out of this country, so that we can be free. Let us follow the COVID protocols. Let us wash our hands. And when we are going out, let's put on our mask properly, so that when we are coming back to the house, we don't infect our people with the germs or viruses. I will tell him that I would like you to visit our school and see how it is, how I manage to tell people how to wash their hands with soap, how to keep social distance and wear their mask properly. And we have to protect our families so that we cannot be affected with COVID-19 or any other diseases.
Michelle, I would say, is very outgoing and very determined in getting what she wants. She will really push to get what she wants. Yes, she's a pushy girl. During the pandemic, a lot of things happened, and what happens to us as a family is we sit down and discuss and also share, so that we bring the children up to speed with what is happening. We ask them what challenges they are facing. Is this something that we can sit down and discuss, or is it something that we can get a counselor to maybe just come and sit with the children alone and see if it can be addressed?
Michelle is in class 7, a very focused girl. She is self-driven. She knows what she wants. She stands out. And I am excited that we have reached this point with her. She will go forward and take that which she wants. And in class, she performs very well. She's very well disciplined. These are the kind of children that you never miss class, unless, of course, the obvious things that may happen. She is also a person who can manage a class very well. Given an opportunity, and she has been a class manager, of course, as a prefect, she is extremely, extremely assertive. We were excited. We were very excited. We take it as a win for the school. We read it to this entire school to appreciate Michelle and also to encourage the other children to know that even a small girl like Michelle can actually do something and get recognition. We are very happy that, the CS actually replied, because it is very encouraging.
We have come to realize that in the school here, psychologically, the children are traumatized, and so we need to give them a lot of avenues to be able to express themselves. So we are working on that together with the teachers. When we give them an avenue like you give them full scarves at random, they just write without writing their names, and we have seen things come out that is going to help us to be able to manage the trauma with these children so that they can be able to remain to purely focus on the academic, because we might be thinking of academic part of it, and remember now the times are shortened, so there's a lot of pressure on the teachers, there's a lot of work to be done by these children. So for them to be able to work so well and focus on the academics, we need to give them a shoulder to lean on. We need to give these children a listening ear, and more so, we need to reach to their hearts to find out what they are feeling. They might not be able to tell us, but if you ask them to write something anonymously, nobody will know who wrote it. You are able to get to know what the children are going through. Then now generalize that to be able to organize talks for the children so that we are able to address their mental health.